Hi everyone, so good afternoon. Welcome to Tuesday Reading Live. My name is Vandana PS, one of the reading trainers from 𝐂𝐚𝐬𝐬𝐢𝐨 Academy. Alright, so today, as usual, we will start with a sample question from part B. Then today I'll discuss about part A in detail, okay? So let's do this question first, then move to part A, okay? So here comes the question. So welcome back. Good afternoon once again. How was this question? Hi Roshna, Riba, Ammu, good afternoon. Okay, so I'll read the question. According to the memo, the exception for prescription of drug. Okay, so my keywords from this question which are memo, exception and prescription. Okay, so this is a little bit a different type of question. Usually, we should deal with a lot of different type of question in part B, like, yeah, always be, it will be from the 3 categories of questions. So here, this is from the 3rd category, this is a memo, but it's not about what is the purpose. If the purpose alla question, it's not about the information, it's all about a very direct question, exception for prescription of drug. Okay, so that is the question. Then, so what about your answer? Let me know in the comment box your answer. Think answer kittiyo. And what is your answer? Okay, so the first option. So when you read a question, always connect with your option. So option number 1 can be given to all. Can be given to a well-known client. So my keywords given well-known client. And from option B, prescription of a drug should be kept under custody until authorized by authority. So my keywords should be then custody authority. And option C may not be solved for walk-in customers. So my keywords may not, then walk-in customers. So these are my keywords from these 3 options. Okay? Yes. Now it's time to read the paragraph dispensing prescription animal drugs. And I've told you in the previous class, when you do part B, after reading the options, you can read the paragraph. Along with reading the paragraph, you should eliminate your answers. Okay? Allengil adu bhayangara confusing aayirikkum. So when you read the paragraph itself, you can eliminate your options. Clear? So dispensing prescription animal drugs. Since adequate directions for safe and effective lay use cannot be written for prescription animal drugs, such products can only be sold on the prescription or other order of licensed veterinarian. Prior to being sold or dispensed, they must remain in the possession of a person. Possession actually which means ownership or control. Even under the authority, under the possession which means their control, ownership of a person or firm regularly and lawfully engaged in manufacture, transportation, storage or wholesale or retail distribution of animal prescription drug products. Okay, so that should be, it's not something exceptional case. That is what they should do something. Okay. And what about the rest of the lines? The drugs may be distributed only by persons or firms authorized by state law. Again, state law authorized cheyenda karyangalanu koduttirikkunne. A licensed veterinarian may legally use or dispense a prescription animal drug only within the course of his or her professional practice where a valid veterinarian client-patient relationship exists. Okay, see? So here, exceptional case nu panna, ee oru case il matram you can do like this. Ingane namukku cheyyam ennalladana alle. So what is the exceptional case here? ഇതൊക്കെ അവർ ഫോളോ ചെയ്യേണ്ട കാര്യങ്ങളാണ്. ദാറ്റ് വിച്ച് കംസ് അണ്ടർ ദ അതോറിറ്റി, വിച്ച് കംസ് അണ്ടർ ദ ലോ, ഇതെല്ലാം ഓക്കെ. പക്ഷേ വാട്ട് ഈസ് ദ എക്സെപ്ഷണൽ കേസ് ഹിയർ? A licensed veterinarian may legally use or dispense a prescription animal drug. That is a keyword from the question. Only within the course of, that means this is the exceptional case. ഇതിന് അങ്ങനെ ഒരു പ്രത്യേകിച്ച് ഒരു ഇതില്ല. എന്താണ് exceptional case ആണ്? What is it? Within the course of his or her professional practice where a valid veterinarian client-patient relationship exists. അപ്പം for example, I am the veterinarian. Suppose I know the client very well, that I can prescribe the medicine to my client. So that is the only exceptional case. So exception which indicates only here. Okay, അപ്പോൾ അതാണ് ഒരു only case എന്ന് പറയുന്നത്. Then veterinarian employed by drug manufacturers or distributors may not legally dispense prescription drugs to lay persons unless they meet the above criteria. Similarly, practicing veterinarians or their employees may not legally sell prescription animal drugs to walk-in customers. അപ്പോൾ അങ്ങനെ അവർ യൂഷ്വലി walk-in customersന് prescribe ചെയ്യാറില്ല. Yeah, they will not. Okay, it is not an exceptional case. That is what they used to. അവർ ചെയ്തുകൊണ്ടിരിക്കുന്ന കാര്യങ്ങളാണ്. So, because of that, you can eliminate which option? Option B you can eliminate. It is not an exceptional case. അത് exceptional case അല്ല. should be kept under custody until authorized by authority. That is their rule. That's their rule on. So contradictory option or opposite option. What about option C? May not be solved for walk-in customers. Yeah, see the last line. That means their rule, which comes under their rule. It is not an exceptional case. Okay, so very clear-cut question. Exception. So what is the exception here? Can be given to a well-known client. അപ്പോൾ ഇത്രയും ഭയങ്കര സെക്യൂരിറ്റി അല്ലെങ്കിൽ ഓണർഷിപ്പ് കൺട്രോളിലാണ് ദിസ് കൈൻഡ് ഓഫ് പ്രൊസീജിയേഴ്സ് ആർ ഗോയിങ് ഓൺ, ബട്ട് സ്റ്റിൽ ദേ കൻ പ്രൊവൈഡ് ദ മെഡിസിൻസ് ഓർ ദേ കൻ പ്രിസ്ക്രൈബ് ദ മെഡിസിൻസ് ഓൺലി ഇൻ ദിസ് പെർട്ടിക്കുലർ ഒക്കേഷൻ. അതായത് ഈ ഒരു സിറ്റുവേഷനിൽ they can prescribe the medicine to a well-known client. So answer is option A. This will be the correct answer. Okay, any doubts? Anything doubt on Riba? Roshna, Ammu, any doubts? Clear? Okay, so what about part B? നമുക്ക് part B നെ പറ്റി just ഒന്ന് condense ചെയ്ത് പറയാം. So in part B we have total 6 questions അല്ലേ, 6 questions ഉണ്ടാവും, and the 6 questions will be in the form of multiple choice questions with 3 answer options. Okay, 3 answer options ഉണ്ടാവും. പിന്നെന്താ, so these questions will be under the criteria, 3 criteria, 3 ക്രൈറ്റീരിയയുടെ ബേസിലായിരിക്കും വരിക. ഫസ്റ്റ് വൺ ഇസ് ഗൈഡ് ലൈൻ, സെക്കൻഡ് ക്രൈറ്റീരിയ മാനുവൽ ഓർ പോളിസി, തേർഡ് ക്രൈറ്റീരിയ email, memo or notices. Okay, so first criteria, first sentence is important, we are reading for the details. Second criteria, the first 3 sentences are important, we are reading for the main idea. And the final criteria, the last lines are always important, and actually we are reading for the purpose. Okay, so this is all about the criteria wise questions. And answers will be, it will not be a direct answer. If you last line la, see a direct line is mentioned there, may not legally sell prescription animal drugs to walk-in customers. That is exact same line aanu. So according to human psychology namukku ippo oru tendency undu, this is the correct answer because it is directly mentioned there. But it's not. So 99% I can say they will not give you the direct answer from the paragraph into the answer option. Adorikkalum answer aayirikkilla. So here answer will be in the form of paraphrased sentence. Okay, entirely different sentence structure but the same meaning. Okay, yes. Okay, Roshna, yes. Reba, Ammu, yes, thank you. So now we are moving to the main part, which is part A. So we have a new topic here. So that is fibrocystic breast. Okay, so that is the material, that is the topic. Okay, how is the material? I think this material is okay, an average material. Okay, not that much difficult, then not that much easy. It's an average material. Okay, so I'll start with part A. ഇന്നലെ നമ്മൾ സ്റ്റാർട്ട് ചെയ്ത് ഡയറക്ട്ലി ക്വസ്റ്റ്യനിലേക്കാണ് പോയത്. ഇന്ന് I'll just explain something regarding part A. Okay, yes Reba, it is an average material, yes. So what do you know about part A? നമുക്ക് എന്തറിയാം part A നെ പറ്റി? Why we are doing part A? Suppose imagine you guys are working in a hospital, I mean in a foreign hospital. Okay, and this is your first day in the hospital. നിങ്ങൾ ആദ്യത്തെ ദിവസമാണ് ഹോസ്പിറ്റലിൽ, and the doctor just wanted you to take a sample from the patient. എന്തെങ്കിലും ഒരു സാമ്പിൾ എടുക്കാൻ ഡോക്ടർ പറയുകയാണ്. So suppose for example COVID-19 sample or corona sample, and you guys have no idea how to take the sample from the patient. നിങ്ങൾക്ക് അറിയില്ല അത് എങ്ങനെ എടുക്കുമെന്ന്. So what will you do in that situation? ഇത് നിങ്ങളുടെ ഫസ്റ്റ് ഡേ ആണ്, ഡോക്ടർ ഇങ്ങനെ പറഞ്ഞു, ആൻഡ് നിങ്ങൾ അതിനെപ്പറ്റി കേട്ടിട്ട് പോലും ഇല്ല, യു ഹാവ് നോ ഐഡിയ. സോ വാട്ട് വിൽ യു ഡു? അങ്ങനത്തെ ഒരു ഒക്കേഷനിൽ നിങ്ങൾ എന്ത് ചെയ്യും? ഹായ് പാപ്പതി, യെസ്, ഗുഡ് ആഫ്റ്റർനൂൺ ഡിയർ. യെസ്, സോ വാട്ട് വിൽ യു ഡു ഇൻ ദാറ്റ് ഒക്കേഷൻ? ആ ഒരു ടൈമിൽ നമ്മൾ എന്താ ചെയ്യുക? യൂഷ്വലി ആസ് എൻ ആവറേജ് ഓർ എ നോർമൽ ഹ്യൂമൻ ബീങ്, അല്ലേ, ഒരു പ്രൊഫഷണൽ ഫീൽഡിൽ വർക്ക് ചെയ്യുന്ന ഒരാളെന്നുള്ള രീതിയിൽ വി വിൽ ജസ്റ്റ് ആസ്ക് സം help from the senior staff. ചിലപ്പോൾ നമ്മൾ സീനിയേഴ്സിനോട് ചോദിക്കാം എന്ന് വിചാരിക്കും, or we would directly ask to the ഡോക്ടറോട് ഡയറക്റ്റായിട്ട് ചോദിക്കാം. But it is a foreign country, so the things are entirely different from our country. Okay, so the patient will not wait for us, the doctor will not wait for us, nobody will wait for us. So what you have to do is, if you are a student who cleared this exam, what you will do? You can take the hard copy or the soft copy from the hospital. Then you will locate your particular procedure. Doctor parna procedure edano. You will locate, you will search for that particular procedure from the copy. Then you will quick read it, fast read cheyum, then understanding, applying to the patient. Okay, so that is the connection with doing part A and your day-to-day activities in a foreign country. Clear? So in each and every part in reading module, definitely there is a connection. നമ്മൾ ചുമ്മാ ചെയ്ത് പോകുന്നതല്ല, ഓരോ പാർട്ടിനും കണക്ഷൻസ് ഉണ്ട്. Okay, so this is all about the connection with part A and day-to-day activities in a foreign country. So in summary, what can I say? It's all about locating answers. നമ്മൾ answers within this speculated period of time, we are trying to locate certain answers from each of the text. അപ്പോൾ ഓരോ ടെക്സ്റ്റിൽ നിന്നും നമ്മൾ answers locate ചെയ്യുകയാണ്. Okay, so that is part A. And for locating your answers, which technique is important here? നമ്മൾ ഏത് ടെക്നിക്കാണ് യൂസ് ചെയ്യുന്നു? We are using the technique that is skimming and scanning method. Okay, അപ്പോൾ skimming and scanning എന്താ? Skimming which means fast reading or speed reading, whereas scanning which means underlining or searching for important keywords. Okay, അപ്പോൾ നമുക്കറിയാം എന്തൊക്കെയാണ് keywords എന്നുള്ളത്. I'm not repeating the things. Okay, so likewise we can read and underline certain keywords from the text. Okay, yes. അപ്പോൾ സ്കിമ്മിംഗ് എന്ന് പറയുന്നത് ഇറ്റ് ഇസ് നോട്ട് എ വെരി ഈസി ജോബ്. ഓക്കെ, പലർക്കും അറിയാൻ പറ്റും. വെൻ യു റീഡ് സംതിങ് ഇറ്റ്സ് നോട്ട് എ വെരി ഈസി തിങ്. ഇതൊരു ജസ്റ്റ് ഒരു പീസ് ഓഫ് കേക്ക് അല്ല. സോ യു ഷുഡ് ഇൻകൾക്കേറ്റ് ദാറ്റ് സ്കിൽ. ഓക്കെ, റീഡ് എവറി ഡേ. അറ്റ്ലീസ്റ്റ് യു ക്യാൻ സ്പെൻഡ് 10 minutes ഫോർ റീഡിങ്. അറ്റ്ലീസ്റ്റ് നമ്മളൊരു 10 minutes സ്പെൻഡ് ചെയ്യാം. ഓക്കെ, അതർവൈസ് ഇറ്റ് വിൽ ബി വെരി ഡിഫിക്കൽട്ട് ഫോർ യു ഗൈസ് ടു സ്പീഡ് റീഡ്. ഓക്കെ, യെസ്. ഓക്കെ, റീബ. Yes, Roshna, Reba, yes, Geeta, skimming and scanning method, yeah. Okay, that is the only method which will help you to find out the answer within this speculated period of time. അല്ലെങ്കിൽ ആ ഒരു period of time ഈ ഒരു method ആണ് help ചെയ്യുക. Okay, so now I am moving to the first question from part A. So please let me know in the comment box your answer for the first question. What is the purpose of USG? So എൻ്റെ keywords ഞാൻ പറയാം. Another thing, when you read the questions, it is very important to underline certain keywords. Question എന്നും keywords underline ചെയ്യണം. അപ്പോൾ ചിലർ ചോദിക്കും why? Okay, അതിനുള്ള ടൈം നമുക്ക് ഉണ്ടാവോ, എന്തിനാണ്? So when you practice things, it should be in that particular way. നമ്മൾ ചെയ്യുന്ന കാര്യങ്ങൾ അനുസരിച്ചിരിക്കും. Okay, if it is a habit, okay, daily നമ്മൾ വായിക്കുന്നു, അഡീഷണൽ മെറ്റീരിയൽസ് ചെയ്യുന്നു, then definitely it will be easy for us. നമ്മൾ ഡെയിലി ചെയ്യുന്ന കാര്യങ്ങൾ നമുക്ക് ഈസിയാണ് അല്ലേ? So likewise make a habit, then it will be very easy. Okay, so when you read a question, underline the keywords from the question. Okay, പലപ്പോഴും ഒരുപാട് സ്റ്റുഡൻസ് എന്നോട് പറയുന്നതാണ്, മാം ആക്ച്വലി ടെക്സ്റ്റ് ചെയ്യുമ്പോൾ ടൈം മാനേജ്മെൻറ്റ് ഇല്ല, ടൈം കിട്ടുന്നില്ല. ഓക്കെ, ഒരുപാട് ക്വസ്റ്റ്യൻസ് ചെയ്യാൻ പറ്റുന്നില്ല. വൈ? വാട്ട് ഈസ് ദ റീസൺ? ബിക്കോസ് യു ഡോണ്ട് ഹാവ് ദിസ് ഹാബിറ്റ്. ഓക്കെ, ഇപ്പോൾ ഹാബിറ്റ് ഉള്ള ഒരു സ്റ്റുഡൻറ്റും ഹാബിറ്റ് ഇല്ലാത്ത ഒരു സ്റ്റുഡൻറ്റും തമ്മിലുള്ള ഡിഫറൻസ് എന്താ? So if a student is continuously have this reading habit, definitely they can skim, they can fast read it, speed read it, pettunnu vayichu keywords underline cheyan pattum, they can memorize everything because they are practicing daily. ഈ പ്രാക്ടീസ് ഇല്ലാത്ത സ്റ്റുഡൻസ് ആണ് അല്ലേ? സോ നമ്മൾ തന്നെ നമ്മളോട് ചോദിച്ചു നോക്കാം, നമ്മൾ പ്രാക്ടീസ് ചെയ്യാറുണ്ടോ ഡെയിലി? നോ. സോ ദാറ്റ് ഈസ് എ റീസൺ യു ഡോണ്ട് ഹാവ് എ ടൈം മാനേജ്മെൻറ്റ്. ഇപ്പോൾ ഡെയിലി പ്രാക്ടീസ് ചെയ്യുന്ന ഒരു സ്റ്റുഡൻ്റ് ആണെങ്കിൽ definitely you can complete part A within 8 minutes. മനസ്സിലായോ? ഈ 15 minutes ആവശ്യമൊന്നും ശരിക്കില്ല. Within 8 minutes you can complete part A. Okay, so please do read every day. Okay, yes. So the first one, purpose, then USG. So these are my keywords from the question. Hi Biju, yes, good afternoon dear. Okay Jissa, yes, Prabjot, right? Okay, I hope your name is so, yeah. Okay, then Roshna, Ammu, Geeta, Reba. Okay Papadi, yes. First one is C. Okay, answer is C. So 1 to 7 set of questions, it is match the following. Okay, so when you read, you can find out from which text is that answer from. Okay, and that's from text to C, as you can see here. Yes. What is mentioned here in text to C? See, indicated in patients with breast mass, a lump-like structure, a hard, dense area, or any abnormal issue areas, as defined by clinical examination, mammography, or USG. So, very clearly mentioned here. Answer is from text to C. Then, common medications used to manage fibrocystic breasts. So, my keywords: common, okay, medications, manage. So where they have mentioned about the management, medications and management ഒക്കെ തന്നേക്കുന്ന എവിടെയാ? Hi Divi, good afternoon dear. Okay, dear. You're from Punjab, right? Okay, yes. So happy to see you here. How are you? Okay. Yes, Reba, it's D. Okay, Roshna, yes, D. Okay, Ammu, so answer is D. Very good, excellent. Okay, Jissa, correct answer, which is from text D. Management, okay. Even though it is management, where they've mentioned about the treatment, I mean medicines have mentioned, yeah, from the last 2 points. The medical terms, medicines mentioned. And the third question, okay, yes, Prabjot, it is D. Yes, very good. And what about third one? Factors that could increase the chances of fibrocystic breast. So, don't write like, okay, if you get that answer, you can write there C, D. Likewise, only the letters. Some students have this type of concern that, okay, whether I can write text C. Okay, that is concern like text C. Okay, don't write text C, just write that letter itself, a particular alphabet matram madhi, so that you can write C, D. Okay, then, so what about third one? Factors, increased chances, yeah. Okay, yes, so what about third one? Very good, answer is from A. Factors that could increase the chances of, okay, very indirect question, not a direct one. Yeah, actually it is in the second para. Alcohol is one reason. Okay, then caffeine, another reason. So what are the factors? Alcohol, caffeine. So we can conclude it as text A. Yes, Geeta, Prabjot, yes, Jissa, Roshna, Ammu, Reba, Shiny, Divi. Yes, it's from text A. Yes, Papadi, it is from text A, dear. Very good, very good. Okay, Divi, text A. Fourth one. What are the other common indicators of fibrocystic breast? Okay, so other common indicators. What about fourth one? Indicators. Instead of symptoms, they have mentioned indicators. Okay, indicators, that means symptoms. Okay, so where they've mentioned about the symptoms? Yes, symptoms mentioned in text B. Okay, I'll count your marks also. Okay, I will marks count and I know that Papadi, Ammu, Reba, Shiny, Divi, Prabjot, Geeta, Jissa, Roshna, yes. And you guys are still, yes, it's almost 4 questions. Yes, and you got 4 out of 4, right? Yeah, then, so answer is, it's from B. Yes, it's all about the symptoms mentioned. So yeah, direct answer, which is from text B, symptoms. And what about fifth one? What instance demands one to have a surgical approach to get rid of fibrocystic breast? Okay, so my keywords, instance, demands, surgical. So where they've mentioned about the surgical approach, surgery or excision, idokku evada mention cheyidekkunna, surgery. Yes. Okay, Surya, hi Surya, second one text D, right dear. So what about other questions, dear? So please let me know. Okay. So fifth one, answer is from, everybody on fifth one, it's mentioned in text D, surgical excision. See? Okay, so rarely surgery may be needed. So answer is D. Okay, so my answer is text D. Sixth one, when does one experience the extreme intensity of fibrocystic breast? So keywords are the kya? Experience, extreme intensity. Okay, so what about sixth one? Extreme, experience, intensity. It's maybe in text A or text B. Because text A is all about the disease condition and text B is all about its symptoms. So what about sixth one? It's all about the yes, text B, symptoms. Okay, very good, Reba. Correct answer. Okay, so it's mentioned here, symptoms can worsen after 30 and intensify again after 35. Okay, so our increase, experience, intensity, it's mentioned in text B. Okay, yes, Surya, third one is text A, right dear? Very good, yes, correct answer. Then the last one, seventh one, who are more susceptible to fibrocystic breast? So, more susceptible, which means very weak, vulnerable, nalla meaning. Okay, yeah, so what about seventh one, who are more susceptible, very weak to this disease condition? And it's all about text A, Anna. Yes, Ammu, Shiny. Yes, it's all about text A. So, fibrocystic breast changes are most common in the people who are pre-menopausal age 20 to 50, affecting estimated 50% of those in this age group. Okay, so that means answer is in yes, text A. Okay, yeah, so C, D, A, B, D, B, A. Okay, Anu, first one is C, okay dear, correct. Second one D, third one A, yeah, yes. Okay, Shiny, 7 out of 7. I know that. Anu, Shiny, yes. Ammu, Reba, Surya, okay. Papadi, Geeta, yes, Divi, and you got 7 out of 7, right? Yes. Okay, I know that. Okay, I was counting your marks also. Yes, Jisa, 7 out of 7. Excellent, dear. Very good. Well, next one, 8 to 14, short answer questions, okay? Let's see. Short phrase. എപ്പോഴും പറ്റുന്ന ഒരു mistake ആണ്, don't write more than three words. Okay, answer should be 2 to 3 words. Okay, in 2 to 3 words. First one, the removal of which chronic abnormality is done through a surgical excision. So keywords are removal, which, then abnormality. So these are my keywords. Adalla nundengil you guys can remove this. I mean, you can unmark this removal and you can mark surgical excision. Idayalum madi. Okay, so yeah. So what about 8th one? Okay, Divi, okay. Okay, Surya, 4th one is text B. Yes. Okay, dear, yeah, it's B. So 8th one in answer endana? The removal of which chronic abnormality is done through a surgical excision. And surgical excision, already we have seen that word, right? Which was in text D. Okay, but rarely surgery may be needed to remove a persistent cyst-like lump that doesn't resolve after repeated aspiration. So answer is cyst-like lump. Our cyst കഴിഞ്ഞിട്ട് ഒരു hyphen ഉണ്ട്. Always remember to put that hyphen, okay? Cyst hyphen lump, sorry, like lump. So answer is this. Okay, cyst-like lump. And next one, what medications are used to decrease the cycle-related hormones linked to fibrocystic breast changes? So what medications decrease then hormones? So these are my keywords. 9th one, very good, Reba. Answer is oral contraceptives. Okay, so that is from text D. Medications nu parayumbol thanne ariyam, it is from text D. And where they've mentioned about this medicines, see, oral contraceptives which lower levels of cycle related hormones linked to fibrocystic breast changes. So answer is oral contraceptives. Very good. And the next one, 10th one, the presence of which tissue might seen at its prime in women with fibrocystic breast. So my keywords, presence, then tissue, women. Yeah, so these are my keywords. Any idea? 10th one and answer enda? Yes. So either you can write connective there or you can write fibrous. Both are correct. You can write connective in bracket fibrous. Okay, so that is the correct answer which is mentioned in text C. Yes. Connective fibrous. Already tissues mentioned there, so you don't have to repeat the same. So answer will be either connective or you can write fibrous or you can write connective fibrous. Okay, but that fibrous should be in bracket. Okay, yes. Okay, Ammu, yes. Prabjot, yes. Reba, connective. Yes, Shiny, it is connective. That's correct. Okay. Then 11th one. What was the initial title of fibrocystic breast? Initial title. What was the? Okay, so understand this grammatical structure also. What was endairunnu? So yeah. What was the initial title of fibrocystic breast? So what was the initial title? Endairunnu? Initial title of this condition, and I hope it is in text A. Yeah. What was the condition called? Yes, it's here. Last para, first line. The condition was previously called. Adana njan parne was aanu. So that means past. Okay, called fibrocystic breast disease. So answer should be fibrocystic breast disease. That you complete it because already fibrocystic breast is mentioned in the question, but you have to write the entire thing because it is a name of a disease condition. Okay. Hi Nazia, good afternoon dear. Yes. Okay. Then 12th one. Which evaluation technique should be employed even if a mildest doubt arises regarding the breast cancer? So evaluation employed, then mildest. Yeah. So what about 12th one? Very good. Needle aspiration. Okay, which is from text to C. Technique that means comes under diagnosis. Okay. So answer is needle aspiration. And where is it mentioned in the second point? In patients at high risk of breast cancer, one of the keyword, needle aspiration should be performed with the slightest suspicion arises. So slightest in mild. Okay, so answer will be needle aspiration from text to C. Okay, yes, LV, Prabjot, it is not fine needle dear. Actually, it is just needle aspiration. Fine needle in the Vanamilla, there is no need to write fine. Needle aspiration is the correct answer. Okay, from text to C, yeah, this particular box, not a box, yeah, here. Okay, then the next one, 13th, the age limits of women that make them the most risky candidates for fibrocystic breast. So my keywords, age limit and risky, or you can mark candidates. Yeah. So what about age limit of the candidate? About the risk and age limit? Yes. Okay. So when you write, it should be, they're not asking you how many. Okay, or a period. Our period number alla chodikkunnathu, they are asking you the age limit. So when they ask about limit of something, you should write between 18 and 22. Okay, so answer should be between 18 and 22. So this should be the answer. Okay, between 18 and 22. Okay. Yes, very good Prabjot. Yes, Geeta. Okay, Surya, between 18 and 22. Okay, dear? Yes, Jissa, between 18 and 22. Yeah, okay. Then 14th one, changes in the level of which hormone? Very direct question. The hormone, which hormone? So changes which hormone? Okay, and one of the hormone which I've seen while I read text B. Okay, so which is a hormone mentioned here? While exact mechanism is clear, fibrocystic breast changes are believed to be caused by fluctuating levels of hormones, especially estrogen. See? Okay, so answer is estrogen. Okay, Shaini, 18 to 22 years, it's not wrong. It's correct. 18 to 22, yeah, it's been between 18 to 22. Yeah, it's correct. Okay. If the years not mentioned, you can't write years. Sometimes they will not mention years here. Years will not be there sometimes. So in that particular situation, don't write years. Years nammal ezhudanda kariyilla. Okay, if it is mentioned, you can write years there. If it is not mentioned, don't write years. Okay. Yep. Then so answer is estrogen. Okay. Then 15th one, we are just jumping to the last set of questions, 15 to 20, which is fill in the blanks. Okay. So what about fill in the blanks? Women could experience the symptoms at its worst once they surpass the age of dash. What age? Age, Anna? Yeah, it is already mentioned in the question. Yes, that is what I'm saying. You don't have to repeat or you don't have to mention that. Sometimes it will not be there, then you can repeat, otherwise it's wrong. But answer, see, 18 to 22, it's a 22. Yeah, 22. So 18 to 22 years is actually, it is correct. Answer is correct. Okay. But if years is not mentioned in the passage, you don't have to write the years in your answer. As well as if years is mentioned in the question also, is it mentioned in the question? You don't have to repeat the same, okay? Let me check. No, nothing mentioned about the years. Years choikkundilla, they are only asking about the age limit. Okay, not about the years asking, so that you can write years there. If it is already mentioned, don't repeat, okay? So answer is 18 to 22 years. Or you can write what? Or you can write between 18 to 22. Okay, so both are correct. Okay, then yeah, 15th one. So what about 15th one? Okay, connect. Okay, Jijo, is that about, yeah, okay, connective matter question. Okay, so 15th one, answer is 35. Is it 35 or 30? I hope it is 35. No. Or 30. Okay, let me check. So, women could experience the symptoms at its worst once they surpass the age of. So, what age is mentioned here? Symptoms can worsen after 30 and intensify again after 35. So, is it 30 or 35? What answer? 30 or 35? Women could experience the symptoms at its worst once they surpass the age of. So, the worst situation, which means again it is intensifying after, okay, getting pinne worse, that means exacerbating. Okay, so answer is 35, not 30, 35. Okay, getting worse. So that means exacerbating. Answer is not 30, 35 one. Okay. 16th one. Okay, Jijo, needle aspiration. Okay, dear. Yes. Okay, yeah. And what about 16th one? Symptoms include breast discomfort or tenderness which can worsen just prior to dash. Before what? Prior, which means before, Anna. So before what? Again, I think it's from text B. Yeah. So breast discomfort, one of the keyword, tenderness another keyword which can worsen just before your period. See? So answer is period. Very good. Yes, Shiny, period. And the next one, 17th one. Fibrocystic breast changes are most common in people who are dash aged 20 to 50, affecting an estimated 50% of those in this age group. Okay, so what age group or in what kind of people? The type of people are? Yes, very good. Premenopausal. Yeah, it's mentioned in text A. Okay, so that is premenopausal, aged 20 to 50. Okay, Nasia, the previous one is period. Okay, Divi, Ammu, yes, period. Okay, and the next one is premenopausal. Okay, okay, Ezekiel. Okay, Ammu, yes, Jissa, Shiny, Papadi, yes, it's premenopausal. And what about the very next one, 18th one? Patients who have at the risk of dash should undergo needle aspiration to get rid of any suspicions regarding the onset of the same. Okay, under the risk of what? Under the risk of breast cancer. See, patients at the high risk of breast cancer, you can go for a needle aspiration. So answer is breast cancer. Okay. Then 19th one, fibrocystic breasts are a common condition resulting in dash changes in your breast tissue. So what changes in your breast tissue? Okay, and the change aanu varunathu? Yes, resulting in lumpy changes. Okay, lump aanu, so that is lumpy changes in your breast tissue. So answer is lumpy. Okay, that is the correct answer. And the final one, question number 20. Removing dash confirms that the lump is a breast cyst and in effect collapses it, relieving associated discomfort. So what about that one, 20? Eda. What about 20th one? Okay, and which is from text D. Yeah. So fine needle aspiration, your doctor uses a hair-thin needle to drain the fluid from the cyst. Removing fluid confirms. So what is the correct answer? Fluid. Okay, so answer is fluid. Clear? And do you have any concern regarding text A? Sorry, part A? Endeavor common doubt on regarding part A. How to answer, how to start a particular answer. If you guys are writing the answers, for example, ഇപ്പോൾ എന്താ പറയുക, ഫോർ എക്സാമ്പിൾ ഫസ്റ്റ് വൺ 8th വൺ ആൻസർ എന്തായിരുന്നു? വാട്ട് വാസ് 8th വൺ? സിസ്റ്റ് ലൈക്ക് അല്ലേ, ഇതായിരുന്നു ആൻസർ. സിസ്റ്റ് ലൈക്ക് ലംപ്. ഓക്കെ, സോ യു ഗൈസ് പ്ലീസ് ടെൽ മീ വിച്ച് ഇസ് ദ കറക്റ്റ് ആൻസർ. ഓക്കെ, ഇതാണോ കറക്റ്റ്? ഓർ one second, let me, yeah, I'll select a very short question, right? Yeah, 14th one answer edukka. Okay, so you guys please tell me which is the correct answer. Engane answer edannu parayane. Okay, whether it is or yeah, which one is the correct answer? Idile eda correct? First one is correct, second one is correct, or third one is correct? Let me please know in the comment box which one is correct. Idile eda answer aanu correct? It's the same, okay, answer is the same, but yeah. Okay, Ezekiel last one. Okay, Shiny second one. Divi second one. Okay, Reba third one. Okay, so these are correct, right? I can say each of it is correct. Idellam correct. Okay, but the thing is that whatever you guys are following, yeah, all three, it is correct. So whatever you are following, you should follow to the rest of the questions. Ningal avasanam vare adanne follow cheyanam. Okay, for example, if you guys are writing all the letters in capital, then follow it from the 8th to 20 set of questions. അത് മൊത്തം അത് തന്നെ കംപ്ലീറ്റ് ചെയ്യുക. And if you're starting with the first letter capital, then follow to the rest of the questions. Or if you guys are starting with a small letter, but if you're writing small letter, always be careful about names. പേര് വരാണെങ്കിൽ don't write the first letter small. Okay, so you should write the first letter in capital if it is a name of something. Okay, yes, അതെല്ലാം മൂന്നും കറക്റ്റ് ആയിരുന്നു കേട്ടോ. അതുപോലെ when you write short answer questions, you don't have to repeat as well in short answer questions and in the fill in the blanks. You don't have to repeat any single word from the question into the answer option. Sometimes the words will be in synonyms also. Okay, അതായത് ആ വേർഡിൻ്റെ മീനിങ് സെയിം ആയിരിക്കും, ഡിഫറെൻറ്റ് വേർഡ് ആയിരിക്കും. സോ ഓൾവേസ് ബി കെയർഫുൾ അബൌട്ട് റെപ്പറ്റേഷൻ വന്നാൽ you will lose your marks. Okay, so that's all about that. Okay, Shiny, 20 out of 20. Anyone else with 20 out of 20? 12 minutes. Very good. Where ആർക്കെങ്കിലും ഉണ്ടോ 20 out of 20? Okay, so that's all about today. Okay, so thank you. Take care. God bless.